welcome to Hatching for Health. I'm your host, Jessica Hatch. Today we are going to talk a bit about cystic fibrosis and just a little bit from my knowledge of cystic fibrosis. This is a genetic disorder that mostly affects the lungs, but additionally affects the kidneys, the intestines, the liver, as well as the pancreas. So we're going to talk more about this specifically with Jason and his daughter, Sarah. And she does actually carry this disorder. So we're going to talk in detail and learn a little bit more about this disorder. Thank you guys so much for being here.
Oh, thanks for having us. Appreciate it.
Yeah, definitely. So tell me a little bit. I know that you guys, were able to reach out and inquire about being on the show to tell your story. So I'm really happy that you guys are willing to talk about it and kind of help educate the public, because I'm sure there's families and children out there that aren't even aware that their child is carrying this and kind of looking for answers. So what specific disorder from the cystic fibrosis does Sarah have?
Well, part of it is breathing. So buildup of mucus on the lungs, and so that requires her to do breathing treatments. So it's kind of a two-step process. The first is a combination of different breathing treatments that she wears with a mask through a nebulizer machine. And so they'll do a combination of hypertonic saline, pulmozyme, those things, that butyrol, and so that can help loosen the mucus. And then while at the same time she wears a compression vest that pumps and shakes the mucus away off her lungs. And so she does that twice a day on a normal routine. But if she's sick or has a junky cough that's lingering around, or if there's just been some illnesses around in the school or in the area, we may increase her treatments 3, sometimes even 4 times a day.
Okay, so you're tiny. So what does this look like? It's a little vest that you actually have to put on, and it does the vibration to kind of loosen the mucus?
Yeah, it goes for 30 minutes.
For 30 minutes. And how often do you have to do that?
Every morning and every night.
Okay. Wow. And as far as the breathing treatment, that's something additionally that you do back to back with the vest?
I do it with the vest.
Okay. Very good. And so this you do in your own home. You don't have to go to a doctor's office?
No, we're fortunate. We have equipment that's set up on a cart. We keep isolated, and so when she's ready to use it, she's very knowledgeable in that she was diagnosed at a very young age. She was about 6 months old when she was diagnosed with cystic fibrosis, and so she's kind of grown up around this. And so she's very much aware of it, and so it's kind of old hat at this point where, if they say, well, we got to increase we have to put in a new medicine, and she's already doing the calculations. How much longer do I have to sit there? Because she's aware that sometimes it makes it go a little bit longer. So all the equipment is there in our house, and so we kind of do all that, and luckily we work with some really cool insurance people that help us out and keep those things updated and maintained.
Nice.
So
yeah. So 6 months old. So what was it that you guys were kind of? There's something different about Sarah. 'Cause I know you guys have 3 other children.
Right.
I guess 2 of which would have already been born.
Yeah, we had 2 older daughters. The only issues they had as infants was acid reflux.
Okay.
So when she started having, it was really kind of like one day, like a light switch went off. Like she was 2 months old, she was fine, happy baby, and then it was just irritated and crying all the time and just not sleeping through the night. And she was sleeping at like 2-hour spurts. It was just made for some long nights. So we took her into the doctor, and it turned out she was at one point failure to thrive. So she was losing weight. And so the first thought was, well, maybe it's acid reflux. And so they tried the acid reflux. Didn't work. It kept getting worse. And she was just more irritated after every meal. Then we switched from breast milk to bottle to formula to high-calorie formula, and nothing was working. And so
And during this, you guys are, kind of aware exactly what's going on. You're just trying different things because of her losing weight.
Yeah, just losing weight and trying to figure out what's causing this. So we went to and when she was born, the newborn screening, they test for cystic fibrosis. There's over 2,000 mutations for CF.
Is there really?
And so in the state of Texas, they only test for the most common ones. And so while she did pass that test, we're looking to other things, and her pediatrician Unfortunately, didn't really have great bedside manner, didn't really quite advocate as strongly for other regimes, so we went elsewhere. So when we were living in Austin, we went to a doctor, then to 2 different doctors in Austin, went to one in Temple, even came down here to Texas Children's. We went everywhere we could and tested for everything until finally they said, let's just do a test for CF if it will shut y'all up. Because we just said, we kind of think it is because we did our research. And so they tested for it, and they did the whole sweat test, drew blood, everything. And this was 4 months of trying to figure out. So she's 2 months old, 4 months go by of every test, and then finally at that 6-month mark, the results came back and they said, yeah, she does have cystic fibrosis, and her mutations at that time were super rare. There was one mutation where she was one of a few, and the other mutation she was one of 2. And of course that was about 7 years ago. Now her mutations, she's got the same 2. One mutation she's one of 5, and the other mutation she's one of 22, I believe, but she's the only patient in the CF database with that combination, the only one.
Really?
So she's on that 1%, super rare.
So this is just for the audience, this is like a perfect example of how rare, yet cystic fibrosis is such a broad, I guess disorder, considering there's 2,000 strands of it. Is that what you said?
2 different mutations for CF.
But yet 2,000 different mutations for it, but yet these, the few that she has are so rare. And so, the treatments vary. I mean, it sounds like it's a very common treatment with the, kind of releasing the mucus and the breathing. But like what different treatments is she having to do because of the rarity of what, she's got going?
That's the interesting part, because a lot of it is we don't know because it's so rare. Now, what the great thing about the Cystic Fibrosis Foundation and the community is that we try to raise awareness and try to put it out there, because CF is, there's no CF research funded by the government. So every donation that comes in, like 90-something% of it goes straight to research. And in fact, it was announced today, there was a new drug that just came out, but that drug is for those with the more common mutations.
Okay.
And so while that's a positive thing to hear, we in the community with the 1%ers are still wondering, like, what about our patient? What about our kiddo? And the great thing about being part of that community as well is that you get to talk to other doctors and other people that are in that field of research. And this past year just got that assurance of, we haven't forgotten about y'all. We're still working on stuff. And there's additional medications. So as her symptoms progress and as her lung function decreases, and as she starts to have to rely on more medications to help with her diet and to help with her growth and her development as well as her breathing, as she develops, we're hoping that more medicines and more treatment options are developed and available, because we like to say in the CF community, we want to make CF stand for cure found. Because right now there is no cure for cystic fibrosis.
Exactly.
So we try to make that, and so we say until it's done, and we want to add tomorrow's today. So by raising awareness, and that's why I'm so grateful that you put this out here, so that we can continue to make this awareness, so that people can know about cystic fibrosis.
Exactly. That's what will
get plugged
drive
in.
more research and, to even specifically the Cystic Fibrosis organization. So what is the link to that? Is it just the
Cystic Fibrosis Foundation, and you Google it and you'll
Okay.
find it, and you'll know about it, and it's all over. There's local chapters, and so there's a community here in Houston, and that we just got. But we were very involved in the one in Austin, where she was diagnosed, and a part of that team, and still have a connection there, obviously with a lot of the parents and patients there.
Okay.
But here in Houston, and so we do things like the Great Strides Walk, where we go out and we raise awareness, raise funds, raise money, and then we all come together and do one big walk. Where,
great.
Where it's just all the different teams, and so.
And are the kids there that are, I guess, kind of old enough to participate, or is it mainly the adults?
It's all ages, and that's the neat thing about this, is that that's the one time we can kind of come together, but then we have to be cautious. So that's the other thing about with cystic fibrosis, is that patients need to stay minimum of 6 feet apart. Which, there was a movie that just came out called 5 Feet Apart, which was about cystic fibrosis. And they called it 5 feet apart because they wanted their 1 foot, and
Really?
because they got told like, yeah, CF patients cannot be near each other
Really?
because bacteria was called pseudomonas, and so
Okay.
they could culture something and get each other sick that you and I can't catch.
So what, I mean, for people that have children, like, 2 children that end up having cystic fibrosis, like, that must be so difficult.
It's very tough. We've met a lot of families that have multiple children with CF, and so you have to take as many precautions as you can and weigh out the options and try to keep things separated and sterile and clean all the time. And I mean, we should invest stock in Lysol because we've got so much of it around the house, so that because we try to keep our house clean. But I can't imagine a parent with 2 children that have CF, and so it's a challenge.
For
It
sure.
is a challenge, and so the 6 feet rule helps keep each other in check, and so that's why an online community is
so important.
is very important. In fact, she's got a buddy. What's your friend's name?
McKinley.
And where does she live? Do you know? Michigan. And so they talk to each other through FaceTime, and they chat.
Really?
And
How
they
cute.
met because my wife and her mom got connected through a CF community board.
Okay.
And so online community presence is super, super big. And so
Exactly.
that's
I mean,
how they
that's
talk.
what I can imagine, I mean, just, thinking out loud, like, I don't have children yet, but, if I did, it's like, how do I, come across a community where they have, a disorder that matches up with my child and be able to learn more. It's usually online. So, even with a show like this, it's putting out there through social media aspects, Facebook, Instagram, YouTube, because that's where so many people are searching and trying to learn about, what it is they have going on, or someone, a loved one.
Correct.
So like, hopefully the show will be able to, gravitate to helping, in each of the various disorders we have on the show. So Sarah, I wanted to ask you, just kind of growing up with this and going to school, like, what are, some of the things that you would say you struggle with, like, just in the environment of an elementary?
It's sometimes hard to keep up with all my friends whenever they're at recess and they're running, and it's hard for me to catch up with them.
Really? Is that just because, like, not as being able to, I guess, breathe as much and kind of keep up endurance-wise?
Yeah.
Oh, okay. But you still get out there and you play with them, and you still partake in the activities there in school?
Mm-hmm.
Good for you. It's good that you're not scared. You do what you can and to participate. I think a lot of children probably aren't as brave as you and don't kind of take that, foot forward. So, and I know that your father talked a little bit about with your skin and stuff. Is it itch a lot, or do you, is it something that just because of the dryness, not being able to sweat as much, or how does that, does it feel? Do you have to itch it, or do you put lotion on?
Yeah, it feels like I have to itch it, and the lotion sometimes doesn't help, so I have to keep scratching it.
Really?
What's one thing you like to put on it?
Vaseline.
Vaseline.
Vaseline helps kind of make it feel better.
And ice packs.
Yeah.
Yeah, you like your ice packs.
Yeah. Very good. And then at school, is there anything that you have to do different, or like as far as like in the classroom, or other than that? I mean, it's just like everybody else, right?
Mm-hmm.
Yeah.
Talk about your school supplies.
I can't share with all the other kids, and we have our own bins, our own table bins, and I'm not allowed to use them, so I have my own art kit that my mom and dad made for me.
Oh, nice.
So they don't share and cross. So like you might have a kid that wipes his nose and then
Yeah.
just using a crayon. So because the teachers can't always disinfect everything all the time, so she has her own like markers and crayons and glue,
Okay.
everything that the
Yeah.
kids can share and as a
It's
community
probably
use.
a good thing in general. Keep their germs away from you.
Exactly. So yeah, she
Yeah.
has to be cautious of that, and then especially sitting next to other kiddos that might have the sniffles or coughing or whatever. Working with the teachers. That's why we have what's known as a 504, which is
Okay.
a document that the school district has to abide by, and we put those things in place so that when it comes time to it, her health comes first, so that her education doesn't get impeded because of
Okay.
her health.
Yeah.
And so we have those things in place. And so one of the things is if there are sick kiddos, that she gets kind of moved away. So if there's a
Okay.
kid that's coughing or sneezing a lot, you know, she knows to say, I'm really not supposed to be near
Yeah.
him. So, and part of that also is, you mentioned the pancreas, so she has to take enzymes, you know, every day. And so she takes that with her meals. And so she has to, if the nurse forgets to give it to her, she has to she advocates for herself to say,
Really?
you forgot
Yeah.
my medicine, I need my medicine. So she
Good for
knows
her,
she has
yeah.
to eat, she has to take her medicine before she eats. And so yeah, it's an inspiring thing to see her stick up for herself, and because she knows, and I've got a great wife who, you know, teaches her, you know, this is what you need to advocate for, this is what you need to ask for, this is what you need
Yeah,
to be doing.
don't
And so
be
we try
afraid
to educate her as
speak
best
up
as
over
possible.
it,
Exactly.
for sure.
Exactly.
Now, just kind of in the visits to the doctor, are there certain things that I guess they kind of give you advice on as she grows older that are going to be like a bigger concern?
Well, right now, one of the things we're looking at is her lung function, obviously. So she does her PFTs, which she blows into a big tube, and it measures her function of her lungs.
Okay.
And so we keep an eye on that. But then in addition to that is her diet, where she's weighing, where she's on that scale, what percentile is she's in as far as her weight and height. And so we look at those things and just kind of the CF team here does an awesome job of just listening to my wife and listening, because my wife is the one that takes her down to her appointments. And so they listen and they, you know, see where she's at and kind of track her. And so they're looking at this, in fact, that it is a rare combination that she has. And so a lot of it is, let's continue to keep eyes on this. Let's see where it goes. And then as it progresses, we can kind of make those adjustments. We're lucky, though, because she's still very young. And her lung functions has been very well and staying up in that high range where it needs to be.
Good.
It's just unfortunate because there are some kiddos who aren't as fortunate that their lung function decreases and they need lung transplants. And then they get the transplant and then there's rejection and then there's other complications. So, you know, we're very blessed to where we're at right now, and we've got a great team. And so it's just one of those, let's just see what the next visit and what happens between now and then.
I see.
In between her clinic visits, and in between those clinic visits, if there's ever a flare up or if she's ever has a junky cough, they're great about, we can call and they'll say, well, why don't you go into a doctor, or why don't you come on down? We'll take a look at her lungs and take a listen.
Yeah.
And so they're really good about staying on top of it. It's just one of those, let's see what the next visit brings. Let's see where she's at between that.
Yeah. Well, I would like to bring Jennifer Mihas. She's a registered dietitian on, and so that we can kind of talk to her a little bit about kind of the, you know, eating habits that Sarah has, and the vitamin intake, and, you know, see if there may be some light she can share for you. So let's bring Jennifer on. We're going to take a quick commercial break. Welcome back to Hatching for Health. We now have Jennifer, who we've brought on, and she's going to talk to us a little bit about the dietetic side and, as you like to call, nutrition therapy.
Yes.
Wonderful. Thank you, Jennifer. We appreciate you coming out and
Thank you so
talking to
much for
them.
having me. Thank you.
Yeah. So, kind of in your experience, you know, from what you've learned about this disorder, what's some of the insight you could maybe share with them, and kind of some questions you might ask to inquire about helping?
So, cystic fibrosis is also a digestive and gastrointestinal condition, right? So we have difficulty absorbing certain nutrients, most important being fat, okay? Because the pancreas doesn't produce enough of the enzyme to digest fat. It's called lipase, and so it's best that a child or anyone with cystic fibrosis has to supplement with enzymes to help better digest, so they don't experience, you know, GI upset and malabsorption for nutrients.
Okay, so that you were even saying specifically that she takes different enzymes on a daily basis.
Yeah, so she does have to take, so she has a specific milligrams for what she's eating. So typically with the meal, I don't know exactly the exact doses, but she knows to take 3 pills.
Okay.
With certain other foods, she may only need 1. And then there's certain foods where like your fruits and vegetables, she doesn't require any of those. But with other food that's got any kind of fat content, sugar, sodium, any of that stuff, she needs to be able to take that. Because if she doesn't, she might develop, like she was saying, some issues, and she's been hospitalized twice for having blockages, just
Really?
because she just can't produce it. Yeah, so she's had issues with that as well. So it's very crucial for diet.
Yeah. So what are some of the other things? Because I know this can affect the kidneys. I mean, so is there stuff related to kind of the items that she's drinking? Does it need more water than normal, or?
Not necessarily. In fact, it's more on a nutrient level. So if she's struggling, it's more the pancreas that's being affected, or affected. It's the pancreatic insufficiency. So the issue there is you're going to have a hard time digesting fat-soluble vitamins, being vitamin A, K, E, and vitamin D. And all are very, very important for organ function. So that's basically something also to focus on. She's actually very lucky because she gets to have the high-fat, high-calorie, high-protein, high-carb diet, and that's everything that we wish we probably could eat. So, and she probably maintains pretty small weight because of that malnutrition risk.
I see. Very interesting. So what's your favorite food?
Pizza.
Pizza? That's still my favorite from a child to an adult. And with sweets, so what about sugar content? Does that kind of play a factor? I mean, there's, stuff that's maybe low in fat but extremely high in sugar. So is the sugar something that she has to watch?
So sugar is an inflammatory for anyone, right? So she's also dealing with a condition where she's at risk of infection, lower immune system, or her immune system is affected. So sugar is going to be something that we don't want to push on to, anyone, but especially someone who's at risk of inflammation or just lower immune system. So really we want something more nutrient dense, very nutrient valuable, and sugar is just not going to be one of them. I will say sodium though. She can actually have high sodium. It's actually recommended, especially in Houston heat. Usually we need about 2 grams, you and I. She can go up to maybe 4 grams if she's sweating a lot from her condition.
Really? So going back to the sugar, has she ever had any kind of outbreaks from kind of too much sugar, or has that typically not been anything affected?
Well, because we have 3 other children, we have to kind of maintain that, because if I give all 4 of my daughters sugar, I'm just looking for a bad time. So we typically try to shy away from that. She hasn't had any major flare-ups. I mean, obviously, if she hasn't had her enzymes and she eats something, especially with a lot of sugar and stuff like that in there, she does get her tummy ache and it does hurt for a little bit.
Okay.
So we try to avoid a lot of sugar.
Yeah.
But as you were mentioning, like a lot of that sodium, so putting salts on her fries and putting salts on things that you typically normally don't put salt on, but she doesn't mind because she likes it. She actually enjoys putting salt on a lot of different stuff. So so we try to substitute that as much as we can instead of just eat a bunch of sugar. Like we want to eat high protein, high calorie stuff so that she can absorb that with the addition of her enzymes so that she can just function a little bit better.
Yeah.
I will say for the sugar though, it's if someone dealing with cystic fibrosis is battling glucose intolerance, because sometimes the diabetes is very well associated with CF. So if that's the case, then absolutely we have to watch our sugar or any carb intake.
Okay. So Jason and Sarah, is there any questions specific to kind of your diet, nutrition that you might want to ask Jen?
No.
Okay.
She might know more than me at this point.
Yeah.
I mean, they had to learn a lot. The fact that didn't have to have a tube feed. I mean, I give round of applause to the parents.
Yeah, for sure.
And you seem so smart in it, so I'm very impressed.
Maybe you need a YouTube channel to teach about cystic fibrosis.
Yes.
Have all the answers. And Jason, is there any questions that maybe Jennifer could touch on? I know it sounds like you guys are on the same page with a lot of things.
We've got a chance to talk beforehand, and I had some unfortunate dealings in the past with working with nutritionists that said, I don't know anything about cystic fibrosis. So when she came in saying, I know CF, my wife and I were like, oh, wow, someone that actually knows about cystic fibrosis and diet. So it's refreshing to see that. So that's why my wife and I take very cautious of what doctors we are seeing and who we do go see. So make sure that they do understand cystic fibrosis. And so, especially meeting with her dietitian and that specializes and understands what her diet needs should be. We're really grateful for that. So, yeah, totally on top of that. And as you mentioned, to avoid that, the GI, the tube, and because some patients have to have that.
Really?
Yeah.
Okay. Well, great. Well, thank you so much. I really appreciate your time and coming out. And we're going to take another commercial break, and we're going to come back with Dr. Alex Lechin, who is a pulmonologist, and we will talk to him about his experience with CF. Welcome back to the Hatching for Health show. We have Dr. Alex Lechin, who has just joined us, and he is a pulmonologist in the greater Houston area. So thank you so much for being here.
Well, thank you for having me.
So we wanted to bring Dr. Lechin on due to the fact that cystic fibrosis is commonly seen by pulmonologists. So he's going to kind of share a little bit of insight with us from his practice and kind of your knowledge on this disorder.
Well, cystic fibrosis, it's one of those frustrating diseases, challenging because it affects usually beautiful in children. Although I'm an adult pulmonologist, do still have a chance to see it. Sometimes, as I was telling the parents earlier, even diagnose cystic fibrosis in adults many times. Not that often, but I still do. Kind of a train in the old times, and so we still get to see and train in PD pulmonologists. And since there are not that many pediatric pulmonologists out in practice, I still get time to see and manage some of it. It's a frustrating disease because, as I said, affects children and creates a lot of chronic problems and logistic problems that affects both the kids and the daddies and the mommies into it. As time has passed, and thankful with all the new developments in genetics, as I was telling you before, there's been a lot of new and exciting treatments. And I do think that in the close near future, genetic treatments and advances will bring us actually a good and complete treatment into the disease, especially with the new advances and genetic final incomplete treatment, modifying the gene and the changes. Since it's, we now, not now, but for a while, we've known exactly where the genetic alterations occur in kids with cystic fibrosis, well, in patients with cystic fibrosis.
I know with the specific strands that you were referencing, share with him on that. I'm just curious if it's something that he's, come across.
Yeah, so the rarity of her mutations, as we were talking earlier, she's got two strands, two different mutations, one of which in the database, we just checked today, she's one of 5 on one strand, and the other strand, she's one of 22. But she's the only one in the CF database with her combination of mutations. And so because it's so rare, we've encountered doctors who, kind of put a big question mark going, okay, it is rare, but we're going to try to look at every aspect and every avenue of treatments.
Well, yeah, the good and bad things about cystic fibrosis is that although it is the same area in a specific gene that causes damage in a part of the cells in the lungs, not just in the lungs, but any place that requires secretions. It's a transporter that the chloride transported. So, although it is known which gene, the gene that is this alter, it could be affected in any number of different mutations. So, there are mutations that, and of course, and you get a gene from your mom and you get a gene from your dad. So we all have in any gene, one from each parent. So, in the case of cystic fibrosis, you can have one mutation and the other one normal, or both mutations affecting the chloride transported in the person with cystic fibrosis. And according to the mutation, the disease behaves somewhat different, from milder to more severe. And so their mutations are more common than others and they're more rare than others. So therefore, when they have target treatment and medications at this point, of course, they do it for the ones that are most common, of course.
Mm-hmm.
So there will be patients, and there are patients that fall outside of the most common drugs.
Mm-hmm.
That's the bad thing. The good thing is that there are many of the mutations that are not as severe as others. And so I was talking to them a little bit outside. I have patients that are diagnosed in their 20s and even in their late 20s. Therefore, their degree of cystic fibrosis is much milder. They have not been affected early on, and they've even gone to have children and kids that some of the most severe cases of CF cannot have children.
Really?
Yeah, because anywhere there's an epithelium
Mm-hmm.
and there are cells. That
Yeah, I
have
read
to,
more. It's related to the man
your
if he
pancreas-
carries cystic fibrosis.
Anywhere there's a gland and you need secretion of any type to move, pancreas, lungs, liver, your reproductive system, in the fallopian tubes, sperm area that requires secretion and movement of any type of secretions, you require fluid. And this
Okay.
fluid is usually rich in chloride. And that part in the cell that produces chloride to go from the cell into the secretion, that is what is affected in cystic fibrosis. And that is what you
So
do
interesting.
to test to check to see if you have cystic fibrosis is done in your sweat. It's called the sweat test.
Mm-hmm.
So you put a patch in plastic and you accumulate the sweat of the patient, and you take the sweat and you measure the content of chloride. And if it is below
So it's
certain
interesting
level,
with because it's like you get this abundance of fluid in the lungs, but yet, fluid, secretion, it's like you have a lack thereof everywhere else.
it's the viscosity. So you get a secretion, you get an amount of fluid, but this fluid, the secretion you get is much more thick.
Okay.
In the case of the lungs, when the secretion is thick, it doesn't move properly.
Oh.
And when the secretion sits there, bacteria accumulates. And the accumulation of the bacteria produces infection. It doesn't clear properly. And this chronic infection produces first damage
Okay.
in the upper part of the mucosa. The infection crosses down to the submucosa and eventually down to the cartilage and damages permanently the airway. So the airways get distorted, altered, and that's called bronchiectasis, which is what you see in when you do biopsies or in the CAT scans or X-rays.
Okay.
Which is different than bronchitis. So this is ectasis, bronchiectasis. So the areas are now all distorted, and the mucus sits there, and it never completely clears. So the bacteria lives there, and it's
see.
never completely clear, so it just sits there. So they run always a low grade of, we call it colonization, not to call it infection, but in reality it's a mild degree of infection, and then eventually if you don't keep it clear, or if you go through a viral process, etc., then the infection comes here, and so the patients with CF continue to have recurrent infection, which makes the disease to progress, further bronchiectasis, further damage, mucus plugs, because
Okay.
it's dry.
So it's kind of it transpires into.
Correct. And
So what are some of, I know, I guess just maybe kind of, as it relates to, information that might help them, as she grows older and is kind of, since you do see more adults, or primarily adults, in your experience, I don't know if very many of them start off as children with it, but it sounds like
Many
they've
of
kind of
them
been
do, yeah.
diagnosed later in life, but just maybe some direction that you maybe could give them. I know y'all have a lot of doctors you see.
The key for cystic fibrosis and any other patient with bronchiectasis, which you can have for many other reasons, and that's what is a little frustrating and difficult for the patient, because it requires a lifelong dedication. You need to keep your lungs clear and clean of secretions, which is the hard
Which is
part.
what the treatments they do
Correct.
twice a day.
So most of the treatment that goes to the pulmonary complications of cystic fibrosis is to try to get rid of the secretions in the lungs. And so the initial part of the treatment that you do with this goes to do that. And so includes nebulizer treatment with different medications from bronchodilators, medications to decrease mucus production. There are medications that break the mucus and makes it thinner. Nebulized antibiotics to try to decrease the oral antibiotics. There are vest, compression
Okay, and
vest,
she does the vest, yeah, twice a day for 30
which is
minutes.
very effective in that it's like shaking a ketchup bottle. When it's here,
Yeah.
and that
So
wave
you got to keep that
produces-
up. That's good for you.
Yeah, you got to do it 2-3 times a day, even if you're not sick. And so it's like cleaning every day, having to clean your house and cleaning your here, and you have to be consistent in doing your breathing treatments. So,
Is there anything else? Because I know that those are actually things that they're following, which sound like very common
and then of course
necessities.
that's why. And then second, there are certain antibiotics that you take long term, not as much for the infection, but because they're being shown to decrease some inflammation in the airways. And then you do some doctors, according to the patient, do some rotating antibiotics, so there's sometimes inhaled and oral.
Is she on very many antibiotics? I don't think
She
we touched on
she
that.
has been. She's been. So in addition to the 2 other hospitalizations, she had 2 other hospitalizations where they did what was called a tune-up, and so they went in and she did round-the-clock IV antibiotics, and she did that for a week straight, and so she did it once last year and she did it again this past Thanksgiving, where she stayed in the hospital, and then when you leave, you kind of take lower doses, but you're still on antibiotics until you finally clear of all the crud and the junk that's in there. But she's had to take some antibiotics, but it's really kind of as needed, not routine.
I see.
But what, as you were saying, the breathing treatments and the chest compression therapies is what she does on a daily basis, in addition to her pancreatic enzymes and things like that. So yeah.
So yeah, little ones. And then of course you treat acute exacerbations, acute infections as they occur.
Yeah.
Children is a little more challenging when it comes to antibiotics because they cannot use certain antibiotics. And then there are the newer drugs that are designed to treat the genetic changes in receptors in the chloride production,
Okay.
but they only work in certain mutations. They're genetic targeted to certain mutations, and they're
I
the
see.
newer drugs, but they're still drugs. They're not changing the genes. That's the new frontier, using CRISP, this new way to actually change the genes.
Okay.
And so that's where the new hope.
Which you were kind of explaining
Well, I
that to
was
me. Have you heard of that? Chris?
Experimental.
Yeah.
CRISP is an enzyme that occurs in every cell. It's the enzyme that our cells uses to repair our own DNA when there's a mistake during doubling. Well, now it's being harnessed as a tool in therapeutic, and it's being used. So what you do is now you use the CRISP. When you know the gene that's abnormal, then you target this enzyme, this protein, and then you can introduce it with a vector, and it goes to the area, and it changes the abnormal gene for the new one.
Interesting. I'd like to, get you all that information because I remember him talking to me over the phone about it. It's probably not something covered by insurance
Well,
currently.
this is strictly
It's
right
more
now
of a-
experimental.
Yeah,
There's no treatment for
it's
it.
almost like with stem cells and exosomes and stuff. Where
Yeah.
it's not something you go and get covered by insurance companies. It's still experimental.
There are a few diseases that have target for the first time, so kind of a new wave. So, but I think that CF would be one of those that probably in the front
Potentially,
line.
yeah. That would
Then
be
of course, then you have the complications in other systems: the pancreas, liver, and the digestive system, and wait and see what happens. Later when they become adults, to see if it has affected the reproductive system. Like I said, I have patients that have had children according to the mutation. So
and been just fine.
she has a lot of hope.
Yeah.
She's so young, And what has happened in genetics and in treatment has been exponential.
That's
just really,
great.
the changes occur, I mean, you see it, they occur, it used to be on a yearly basis. I mean, this is now month to month.
Yeah,
It's
were
just
you?
a lot.
He was just telling me there was a medication that came out today, not necessarily for her mutation, but
And
it's
I mean, I
for
don't
cystic
keep,
fibrosis.
I don't keep at the latest in the CF literature here, but I keep in general, and I didn't know. It just informed me today that the new triple therapy, I knew there was a third one coming along, but he told me that the new one just got FDA approved.
Yeah, it was just a few hours ago.
They just
Yeah, it was just released. So because we're in social media and connected to the
Yeah.
CF Foundation, and so you find those things out. And it literally just came out like literally a few hours ago.
Oh,
so,
wow.
so it's new. So
Very
yeah.
interesting. Is there any other questions, Jason or Sarah, that you guys have for Dr. Lechin?
She mentioned earlier that she kind of struggles a little bit keeping up with some of her friends, running around and things like that. Do you know of like any like exercises or something she can do before play that might help her stamina a little bit outside of a compression therapy?
Well, first of all, what is she using now? No, before I tell you.
Well,
what
she's
else
doing
she
she's using the chest compression therapy, and
But
she does
usually with
breathing
the
treatments.
compression, we use the compression along with some form of inhalation.
She has a nebulizer, yeah. And,
I know, but what do you put in the nebulizer?
Pulmozyme, buterol, and hypertonic.
That's it?
That's it.
Okay. She does not have any other inhale?
She does have an inhaler.
Which one?
I believe she's.
Just plain albuterol?
I think it's a buterol inhaler that you use, right, with the mask. Yeah.
So I don't see there any anticholinergic called, LAVA or LAMA. And I know that there are some pulmonologists and pediatricians, and I give you my take on it. First of all, before she goes exercise and here, I would recommend her before to use her rescue inhaler.
Okay.
Now, I see, and there's some people who do, people who don't use the anticholinergic, the Atrovens, Ceravens, and they think, or the thinking behind it is, this is an anticholinergic, and that tends to decrease mucus production, that because it decreases mucus production somehow, it's going to increase the viscosity of the secretion. But if you really look at the pharmacology and the physiology of mucus secretion, and there is a study here, when you decrease the cholinergic tone to the airway and you decrease secretion, you don't change the viscosity. So I use routinely, and it helps in my patients, when you add to the nebulizer treatment and the bronchodilator area, not just the bronchodilator part, the albuterol, but the anticholinergic part.
Okay.
And there are combinations that come in combination that has bronchodilator with a antimuscarinic is the name, but it's an anticholinergic.
Gotcha.
So that combination both has bronchodilator and anticholinergic. So it decreases mucus secretion and helps with the bronchodilation, and it would help with her stamina.